How we started to plan for the pandemic is we were hearing stories from our colleagues up in Seattle about these cases that were coming in. We, of course, had heard all the information, all the news from China, but in Southern California, we didn't know of any cases. My fellow intensivists, Dr. Ponstiello, Dr. Marquez, Dr. Qureshi, myself, we all started getting together and trying to learn as much as we could.
Luckily, being part of a large organization like Providence, we were able to connect with physicians from Wuhan, colleagues that worked on the East Coast, kind of pick their brain and see what was working and what was not working for them.
So from that information, we started to develop our protocols, try to develop this area called the IICU at that time, Interventional ICU, in order to create negative pressure rooms so that we could take care of these patients while at the same time protecting the staff, protecting nursing, and protecting ourselves.
This took all hands on deck from everybody, and imagine we typically already work over an 80-hour work week, and it kind of went over 120 at times.
With the feelings that we all were having and the same emotions we were going through, that bond is really why I was able to come to work every day and work the hours that I worked.
I was a patient in Mission Hospital. I was one of your very first COVID patients. I came in on my birthday on St. Patrick's Day, and the very next day I ended up on a ventilator.
So I was in the hospital at Mission for a little over a month and a half dealing with the COVID diagnosis that I was given in the beginning of August.
So I spent a total of 39 days in the Mission, 17 on a ventilator, and I spent, I think, 31 days in the ICU.
Was in the hospital for about 5 days and ended up on a ventilator for approximately 2 weeks.
When I came off the ventilator the first time, I really knew at that point I was dying. And they said, we're going to do everything we can to save you.
We'd try to call the families on a daily basis to give them updates. And it would be difficult to say, look, your family member is not doing well. Meanwhile, they could not be here in the ICU and see what their family members were going through, what the patients were going through.
At times you would hear, families cry over the phone. I got a little choked up about that because just hearing families not being able to be here was, it was tough.
We had to create a whole new way of communicating with families. Just a phone call we didn't feel was sufficient. So we started the administration, and as well some family members donated iPads so that we could do FaceTime with the families so that they could see what the patients were going through and they could see our face.
I mean, the moment I saw my wife, the look on her face, seeing me and smiling and laughing and saying it's okay. We're gonna get through this together.
When a catastrophic situation occurs, you really see who steps up and who steps back. I am really proud that the staff here at Mission Hospital, the physicians, the nurses, the respiratory therapists, EVS, the physical therapists, occupational therapists, everyone, we had a strong group of people that stepped up and faced the pandemic and did everything they could for the patients.
It truly has been an honor to work with everyone, and really being able to see why people came into the healthcare field. It has been beyond amazing and touching, and I just am more blessed than I can even say.
The thing that I'm most proud of is the patient care and the positive outcomes and the low mortality that we had.
Yeah, the time that I spent here in Mission Hospital, the amount of thoughtfulness and caring provided to me and my family can't thank them enough.
And it's been an honor for me to have participated in the care of a lot of these patients because ultimately they trusted us. They trusted Mission with taking care of them. And to me, that's the biggest gift, is having somebody else trust you to take care of their most precious thing, which is your health. That's the thing I'm most grateful for.
You know, obviously, thank you is that's not enough. What I'm most thankful for are the opportunities that I now have to get to spend with my family, my wife and my daughter.
I can never show enough thankfulness or gratefulness, and I feel like I could never ever, show my appreciation deep enough. But I would just give you a great big thank you and say, thank you for becoming a doctor, thank you for being in mission, and thank you for being my doctor.